This is episode 2 of Doc Discussions with Jason Edwards, brought to you by the Friends of St. Luke's, and I'm with Jeremy Leidenfrost, a cardiothoracic surgeon. Jeremy, how you doing?
I'm doing great. How are you?
Good. You just got out of surgery?
Just got out of surgery.
Big case?
Ran over.
Yeah. It seems like everybody gives you the difficult cases.
It was a difficult case. The guy had very, very diffuse calcified coronaries that we had to sew bypasses to.
Okay.
So they were very difficult to sew, and
the calcifications make it harder to sew.
Yeah.
Yeah.
And
Okay.
it makes it hard to find places on the coronaries where you can put a bypass, right? So.
Yeah.
But it all ended up well, and the guy's seems to be doing well. So
Are they doing the veins still? Are they taking the veins out?
we use artery from the chest wall, artery from the arm, and then some vein from the leg.
Yeah.
We always use more than one conduit, arterial conduit if we can, because those are more durable.
Okay.
So we try to use as many arterial grafts as possible, because those last a lot longer than veins do.
The wall is thicker of the artery, and
Yeah, arteries are just meant to carry arterial pressure blood,
Gotcha.
whereas veins, they weren't, we didn't grow those to carry high pressure blood. They work, but they don't last as long. So
yeah. So this is my brief overview. Heart pumps blood out to the arteries. The arteries are thick and they can handle that high pressure from the blood. But once it goes through the muscles, it gets into the veins, and it's kind of a slow slug back, so they don't need to be thick.
Right.
That's like an amateur's overview
Yep.
of
Veins bring
cardiovascular.
it back. Arteries bring it to the organ. Yeah.
So you were you a hockey player? Is that right?
Yeah, I was a hockey player. I played varsity all 4 years of high school, and then I played some in college. I went to University of Denver, which is a Division I school.
Is that right?
First, and then I transitioned to Miami of Ohio, which is in Oxford, Ohio.
Oh,
both Division I schools, and I played club because I couldn't make the Division I team. So I played hockey for quite a while, and now I coach my son, who's
Is that
8.
right?
Yeah. So.
And are you really even keeled and never yell at them or anything like that?
Never yell at them.
Yeah.
Never.
Yeah, I'm the same way. It's they just kind of know, and it's just about having a Zen chi. Yeah, that's good. Now, did your dad coach you ever?
No, he coached he never coached me, but he
Yeah.
coached my younger brother's baseball team.
Okay.
Yeah.
Would he yell, or was he kind of even keeled?
He was pretty even keeled.
Yeah, he's still pretty even keeled. Yeah.
More now in his older age, yeah, for sure.
And so, do you feel like there are lessons that you learned through your hockey career that have helped you become a doctor or be a good doctor?
Yeah, I think probably if you've ever played any type of team sport, the teams that do well are the teams that work well together.
Yeah.
And it's the same with medicine, especially in heart surgery. You can be the best surgeon in the world, but if you don't have a good team around you, your outcomes are not going to be good, because you can't stay with the patient the entire time. You have to go home and get some rest.
Yeah.
We're lucky that we have incredible intensivists in our ICUs that trained to take care of heart surgery patients.
Yeah.
So that makes a big difference. It's not just somebody who, kind of does critical care on the side. They train to do that.
Yeah.
Our surgical assistants in the ORs have been with us for a very, very long period of time.
Yeah.
They're incredibly skilled. They're the ones that take the conduits out that we use. And they're
So they harvest the
really
arteries and get
they
them
harvest the peripheral arteries and veins.
Got you.
So it's hard to do a good job doing bypass surgery if you don't have good conduit that's been taken by someone who's really good.
Yeah.
And honestly, doing extremely difficult cases is a lot easier when the guy on the other side of the table from you has been doing heart surgery for 30 years or 20 years. Didn't just come out yesterday. So that makes my job a lot easier, and it makes our outcomes better. Our anesthesiologists also trained just to do cardiac surgery anesthesiology.
Is that
and that's
right?
not that's something that you find everywhere.
Yeah.
That's kind of specific to some of the bigger heart surgery centers in town. Where all the anesthesiologists that practice there went to school and trained to do cardiac surgery anesthesia,
Yeah.
not just any anesthesia.
Yeah.
So that, I think we've put together a very, very good team here. Everybody works well together, and, sort of drawing the correlation to hockey, if you don't have a good goalie, you'll never win any championships, right? So it's the same way in cardiac surgery. The team is so important in cardiac surgery. It's not a one-man show.
Yeah, you remind me of like the Emmitt Smith, and you're like thinking your offensive line. You're like saying, if my line wasn't there to block for me, I wouldn't get any
you got
yards.
nothing. That's right.
And I think another thing I think is helpful is just working with the same individuals so often that you can predict what they're going to do, and you know what they're going to do, and you know when you can count on them.
Exactly.
And that makes a huge difference.
Exactly. The scrub nurse that I work with most of the time, I was a fellow in training, and she was a scrub nurse where I trained, right?
Yeah.
And she came out to join us.
Yeah.
And I've been working with her for, over a decade now.
Yeah.
And I don't even have to ask for stuff. She knows like
what's happening,
what point in the procedure I'm in. I just hold my hand out and she gives me exactly what I need.
Yeah.
So yeah, I feel, very, very privileged to be able to work with, such great people.
Yeah, yeah, I agree. And I think, certainly one of the strengths of our hospital is, there's many, but just the nursing staff, and I think that's really where we shine, and it just makes everything better. It just makes everything better.
Yeah.
Another thing that I think is helpful from sports is a lesson that kind of carries over is the grind. Sometimes it's you go through COVID, you got a lot of people on ECMO, and you're working so hard, and you're used to the grind, and we all have a tendency to feel a little bit sorry for yourself, but kind of sports weeds a little bit of that out of you, and you're like, you know what? I got a mountain to climb.
Dedication and hard work.
I'm wore out, but you just keep going.
Yep.
Just keep going.
Yep.
And I think that's a huge part of life. When tough times come, whether you're a patient or it's your job or whatever you're doing, a parent, it's just hanging in there and saying, I'm going to keep going. I'm wore out.
And it also teaches you that you won't be successful all the time. You will fail.
Yeah.
Right. And you have to get back on the horse.
Yep, and you got to keep
going. You will lose games.
Control what you can.
Yep.
And plenty more wins than losses.
Yep.
But not only are sports so good to teach you those lessons, it's also a great way of socializing you. Your buddies give you a hard time. You got that camaraderie.
Yep.
And in many ways, I think as kids who are young, I think about them going through high school. I think one of the main things that they need to do in high school is just be well socialized. They can learn their facts and stuff like that when they get in college.
I commonly tell my wife, because I haven't gone to a lot of the parent-teacher conferences because I'm always working.
Yeah.
And I just tell her, I say, I don't really care about their grades all that much. I just care that they work hard and they get along with people.
Yeah.
Because that's really in life, that's all that really matters.
Yeah.
People do well in life that work hard and get along with other people.
I agree completely. Like if we're hiring somebody new to my department, I can teach somebody how to do a job. I can't teach people how to be normal.
Right.
It's a way more complex thing. You just can't do it. And so you just hire people who are good people who have that, they realize that there's a ton of value in doing their job because it makes a positive difference in this world, and that helps them when tough times come in the department. It helps them realize that I'm not just working to get a paycheck. I'm not just working, to come in and do my task. I'm making a positive difference in this world. And I think it's kind of the opposite of being nihilistic, where you're just like, oh, well, what's it matter? We're all going to end up being dust anyway. It's like, no, you're a consequential person, and you matter. And I think that's been the fuel that's pushed a lot of people in the hospital to keep going strong through COVID, is to realize like you make a difference. And really, you see everybody contributes in society in their own way to chip in and keep the world turning.
Right.
I think everybody's really stressed right now for a lot of reasons, but it's like, just like sports, sometimes you're down in the game. You keep going.
That's right.
Because
That's right.
every once in a while, against the odds,
That's right.
you'll win. And
That's
people
right.
are willing to get into a lopsided battle, and they're willing to fight even when the odds are against them. And it's when you get those victories, it's so good.
Yeah,
You know.
I totally agree. I totally agree. Yeah, I had a case last week that is a post-infarct VSD, which
Okay.
is a horrible, horrible problem. It's when someone has a heart attack that's so big that the intraventricular septum, or the part that divides the left side of the heart, the high pressure side from the low pressure side, it dies and it rots out and it leaves a hole.
Okay.
And they're notoriously deadly problems.
So you got high
Very,
blood from
very-
the left going to the right.
Very, very high mortality problem. And, I kind of went into that case thinking, whew, this lady's probably going to die.
Yeah.
Because, I think I did 2 of them in training, and they both died.
Yeah.
Luckily we went in there and we patched it as we always do. And the patch held. That's usually the problem, is that you get in there and you sew a patch to rotting meat.
Yeah.
Right? And they usually tear out, and then the person ends up dying. But against all odds, she did well, and was getting ready to go home. So
I know in both of our jobs, you kind of get used to the ups and downs, and you kind of temper yourself, or your prior experience serves as a ballast to kind of keep you from going too high or too low. But man, when you get those wins, sometimes it's like it really hits you, and you're like, I appreciate that one.
Yeah. But it's a tough business. That's what my dad always says. Heart surgery is a tough business.
Yeah, and you need tough people to do it. In my field, where people get cancer, what I see a lot of times is people, they're faced with this diagnosis, and it's psychologically, it's really tough to kind of accept and move forward. And I always tell patients, you got 2 options. You can roll over and let it get the best of you, or you can straighten your spine up the best you can and fight. And it's better living to fight, no matter what happens. It's better living to fight if you can.
Right.
And that's you see the patients fighting, you're fighting with them. I think one of the things that's lost is how much we get back from the patients.
Yeah.
I've had days where you feel suboptimal, and then the patient comes in and they hug you or tell you thanks or high five or have a good scan result, and it's like it's just fueled to get you through the hard times.
There's definitely clinics where people walk in and nobody thought they were leaving the hospital.
Yeah.
You know what I mean? And we commonly will take them over to the ICU and say, you got to go see all the people that took care of you, because usually when they leave the ICU, they're in pretty rough shape still.
Yeah.
They go to a skilled nursing facility or rehab or something like that to learn how to walk again or get enough strength to walk again. And a couple months later, they walk into your clinic with normal clothes on and they look like a normal person off the street, and it just blows your mind. And we take them back over there to because we want to give the nurses that same sort of like, oh my gosh, look what we did.
Yeah.
This guy's alive and he's normal.
And it makes you realize all the hard work you did mattered.
Right.
It made a difference.
Right.
Even against the long odds.
That's right.
You keep hanging in there. You keep gutting it out.
Yep.
That's a really nice thing and a really thoughtful thing to do for the nurses, because and the whole ICU staff, because that's tough work. Yeah. Another interesting thing about you, you're a little different than most people.
I'm really different.
The travel, you got like a Winnebago or something like this?
Yeah, we've got an
travel
RV.
in?
We have an RV.
RV.
The first time I think we stayed in an RV, we rented one for one of my cousin's weddings, who got married on his farm, way out in the middle of Missouri. And the kids had such a blast. I thought, well, gosh, I got to get one of these things.
Yeah.
And I've always liked big trucks, and I've always wanted like a Class 8 semi, the ones like pull trailers and stuff.
Okay.
So this is kind of like a nice little compromise. It's a pretty big RV.
Yeah.
With a sort of like a medium duty truck chassis in the front, like a
Okay.
big Freightliner.
Yeah.
So it's fun. Yeah, we go all over the country, and we've been out west. We've been the Canadian Rockies. We took it to Nova Scotia and all those places. So.
Can you like do the horn?
Oh yeah, it's got an air horn.
Okay. Did you ever see Over the Top with Sylvester Stallone, where he was like an
Yeah,
arm
there's an
wrestler?
arm wrestler. Yeah,
You don't have
it's
one
been
of
a
those.
while.
You don't have an arm wrestling thing
No,
in yours?
not in
okay.
there.
I think if you're trying to take it to the next level, it's just worth considering. I
Well,
don't know where you get one of those, but
Yeah, well,
just some pulleys and
my buddies and I also, so we've kind of gotten interested in high performance driving.
what's that?
And this is tracking your car, taking your car to a track, like a
Okay.
racetrack. And we're using it for that now. So 2 of my anesthesiologists are interested in this as well, and we use the RV. And once every spring and once every summer, we take our cars to racetracks,
Okay.
and we just drive around the racetrack. Sort of in like a controlled setting.
Are they're far away, the racetracks, or are they close by?
The one is in the middle of Indiana. The other one, there is actually Gateway is here.
Okay,
So we've
yeah,
been
sure.
to Gateway. We've been to Bowling Green, Kentucky, which is a racetrack at the National Corvette Museum
Yeah.
in Bowling Green. So they're kind of all over the place.
There's one out in Arizona it's like a Dodge only track or something.
Is that
like
right?
this.
We've not been there. That's a pretty long drive.
That's a long haul. But I bet the
But we
the
pack up the
Winnebago would be
RV and
fine.
we put the cars in the trailer and go.
Yeah.
It's fun.
I should get my Tahoe out there sometime. Okay. The one thing that's your team especially has been through in the cardiovascular ICU, COVID. It's been crazy the last couple of years.
Yep.
What would you say like you've learned over the past few years or something you do to cope or what areas have you grown in the last few years due to the adversity of COVID?
Oh boy, that's kind of a hard question.
Yeah.
How have I grown?
I mean, have you been able to? I mean, do you do something now to cope?
Yeah, I mean, I
better,
think
or-
that COVID was such an unknown when it came. Basically, a lot of things in medicine you do every day, you learned about in training, right?
Yeah.
You showed up as a trainee and they told you, okay, this guy's got this type of cancer. You aim your laser or whatever you do at whatever cancer it is, and you
Push
type
the
in how many rads you want to do, and you press the button, and
Yeah.
So a lot of it that we do on a day-to-day basis, we learned about in training.
Yeah.
With COVID, that all went out the window. Nobody knew how to treat these patients. You basically made it up as you went along. And, I found myself listening to podcasts and things like that, trying to get knowledge from others that hadn't been published yet.
Yeah.
But people were talking about, their experiences and things they've done. And that's very unusual in medicine, right?
Yeah.
Usually, everything's very evidence-based. You go to medical school and they teach you how to practice evidence-based medicine, and that's all BS.
Yep.
Now with COVID, right? Because there's no good data for a lot of the things that we did to treat some of these patients.
Yeah.
It was all, we take some of the knowledge that we had from treating, patients with really bad flu and things like that. But it was so much of an unknown that we kind of had to make it up as we went along and learn as we went along. So I think, I sort of learned how to do that because everything that I had done previously in heart surgery, I learned from somebody else. They taught me, this is how you do this,
Yeah.
right? But with COVID, it was kind of like, okay, well, there's a 50-year-old in the ICU. They've been intubated for, 2 days. They're on 100%. They can't oxygenate them anymore. What do you want to do? What should we do?
And everybody's looking to you.
Everyone's
and
looking
the
at me.
buck stops
This
with you.
person is going to die.
Yeah.
They're telling, we can't oxygenate them anymore. They're going to die in a couple of hours. What should we do? There's no data to say that ECMO works with COVID, right? The outcomes are any better.
But it makes sense.
But you kind of have to make the decision. Well, we're going to have to give it a shot and see what happens. And sometimes people lived, and sometimes people died. We still have COVID patients on ECMO, and there are still unknowns. Some people we've had on ECMO for months, right?
Yeah.
And they haven't gotten better. And what do you do?
Yeah.
They're not getting better. What do you do? Nobody knows. Nobody knows that answer. So yeah, it's been like a growing experience as a physician, just to kind of have to go there and sort of like chart new territory yourself.
Yeah.
Because nobody's giving you the answers. You don't have a mentor to look at and say, okay, what do we do now, right? They're not there.
And what I've learned over time is when somebody comes to you and you don't have that mentor there, but maybe you go find your mentor, usually they look at you and say, I don't know.
Yeah.
Your guess is as good as
yeah,
mine.
you
Almost
know,
always.
you call everyone you know and you say, this is what we've got, and they say, well, we had something similar and this is what happened, but I don't know either.
It helps us learn a lot about team leading too. People come to you with all sorts of stuff that you have no idea. How far apart should we stand? Right. What do you think about this vaccine? And it kind of brings up something called the fastest frugal heuristic, where you'll never have all the data for anything. You'll never have enough data to make your decision. But if you're on the plains of the Serengeti and you see like the weeds move and you hear a lion roar, it's okay to just assume that there's a lion there and to get out of there.
Right.
And it's kind of a silly example, but
right.
a lot of things in life and medicine, but a lot of things in life are like that you're like, parenting's like that. You're just winging it. You're just winging it.
Yep.
It's your first run,
right.
and you're just like, this seems like the right thing to do.
Yeah.
And every parent that's been in your position has done the same exact thing.
That's right.
And it sometimes takes some courage, especially when the consequences are high.
That's right.
And you learn a lot about who you are.
Right.
And you certainly adapt and become a better, stronger person through the adversity.
Yeah. And a lot of adversity does come when, there's something that's uncharted and there's no answer.
Yeah.
And someone has a different idea, and you have to learn to respect that. So,
like life, plenty of stress. It's like lifting weights. You get stress, and you get adaptation, and you get growth, and we get better. And I do think that if we have, hopefully not, but if we have future pandemics or stuff like that, we'll be better as a society to deal with it. We figured out what goes wrong. Now, hopefully, it's another 100 years before we have something big. But my hope is that that growth will serve us well moving forward. Jeremy, thanks so much for spending time with us.
Yeah, absolutely. It's fun.
I always have a great time talking to you, and I appreciate your time, and I know how busy you are and what great work you and your team do. So thank you so much. This is the end of episode 2 of Doc Discussions. Thanks for joining us. Brought to you by the Friends of St. Luke's. Appreciate it.